Quality Watch is an educational production of IPRO. Opinions expressed reflect the views of the speakers only and not those of any company or agency. This podcast is intended for private, non-commercial use only. Please visit IPRO.org to read our full disclaimer and terms and conditions.
Welcome to Quality Watch, the podcast focused on healthcare quality improvement. Quality Watch is a production of IPRO, a trusted partner of federal and state agencies working to measure and improve the quality of healthcare for all. I'm your host, Dr. Edison Machado, Senior Vice President of Strategy Solutions here at IPRO. In today's episode, we'll cover clinical staffing shortages, a project linking air quality to health concerns, and the latest data on birth rates and life expectancy. But first, a few quick headlines and updates from around the nation and here at IPRO. May is Mental Health Awareness Month. Each week in May, the Substance Abuse and Mental Health Services Administration, or SAMHSA, is spotlighting a different aspect of mental health. They're starting with a focus on supporting older adults' mental health, followed by building strong foundations for children's mental health, and hope and support for serious mental illness. The last 2 weeks of the month highlight the connection between mental and physical health, as well as the power of community and connection in mental health. For more information and a downloadable toolkit, please visit samhsa.gov or samhsa.gov. With funding from the Kaiser Permanente Community Health Fund, the Denver Department of Public Health and Environment is partnering with a group called Love My Air, which provides real-time air quality monitoring by placing air quality monitoring kiosks at 3 health centers across the city. The goal is to give patients and providers information about air quality so that they can make informed decisions about outdoor activities and be aware of the impact of pollution on their health. State Medicaid directors, take note. Since last year, the Centers for Medicare and Medicaid Services, or CMS, has required that states annually submit and certify specific healthcare quality measures for Medicaid and the Children's Health Insurance Program. For 2025, there are close to 50 mandatory and optional measures that need to be calculated and stratified by race, ethnicity, sex, and geography. For more information, please feel free to visit the IPRO website. That's IPRO.org. And IPRO's End-Stage Renal Disease, or ESRD program, has launched its own podcast. The Kidney Cast, as it's called, is hosted by patient services specialists Brooke Andrews and Shazina Andiapan. Their goal is to educate listeners about the latest in clinical management of kidney disease, discuss ways to improve patients' quality of life, and explain the role of ESRD Network Program. You can find the Kidney Cast at esrd.ipro.org or wherever you listen to podcasts. We'll be right back after this message.
What does better healthcare realized mean? Well, for military veterans and others, it means knowing that their healthcare meets the highest standards of quality. IPRO is seeking physician reviewers to join our case review panel for state and federal contracts. We're looking for board-certified physicians with at least 5 years of active clinical experience who currently work at least 20 hours per month on direct patient care. In return, you can work as little or as much as you'd like reviewing cases for medical necessity, appropriateness, utilization, and other measures. You'll be compensated by case and also rewarded by the knowledge that you've helped ensure that the highest quality of care is provided to our nation's veterans and other vulnerable patients. That's what Better Healthcare Realized is all about. Learn more by visiting ipro.org/clinical-reviewers or calling 888-404-6285. That's 888-404-6285.
A March 2024 survey by the American Healthcare Association found that 99% of nursing homes currently have open positions, and 89% are recruiting for registered nurses. 72% of nursing homes said their current workforce levels remain below pre-pandemic levels, and 66% of survey respondents expressed concern that they may have to close their doors if their workforce challenges persist. And this is a problem that extends across the entire healthcare system and is expected to get worse. Nurses aren't the only professionals affected. There are forecasted physician shortages as well. And in April, a federal judge struck down the previous administration's long-term care staffing mandates, prompting cheers from the nursing home industry. But while they were celebrating the ruling, many nursing home industry experts have continued to work hard to find long-term solutions to the problem of facility staffing shortages. Here to discuss the scope of this issue, its impact, and some potential ways to address it is Patrick Archambeault, Assistant Director of IPRO's Healthcare Quality Improvement Program. Patrick is a registered nurse by training, holds a master's degree in nursing, and is certified in case management. Welcome to the program, Patrick.
Thank you, Eddie. Happy to be here.
Great. Well, let's get started, Patrick. Patrick, can you start by sharing some of the causes of the nursing shortage?
Sure, Eddie, that's a big question. And I want to spend a little bit of time on the answer because there are multiple contributing factors. Number one is burnout for sure, especially post-COVID. And so, as you know, clinical staff were essential employees throughout the entire pandemic. And it was business as usual for them, except it really wasn't. And that was because the hospitals were flooded with COVID positive patients and the nurse to patient ratio was off the charts. And so, there was a pause on certain regulations that allowed the clinical staff to oversee more patients, but it soon got to critical levels. Nursing facilities, home care agencies weren't able to accommodate referrals, so patients sat in an acute care bed for days well beyond their expected length of stay. I think the burnout really started when the clinical staff began contracting COVID themselves. And so an already stretched nurse-to-patient ratio now stretched even further and eventually to the breaking point. And so agency staff were brought in to offer relief, but then there was pay discrepancies between agency staff and clinical staff, which created tension and frustration amongst the nursing staff. And speaking to peers, though, the biggest impact was watching patients die without families being able to surround them. And nurses frantically tried to use FaceTime. They tried to use Skype to connect patients to loved ones, but that really took the biggest toll on the clinical staff. So effects on the patient and families, do more with less mentality, the work to cover as many shifts as possible. That created a level of burnout that pulled a lot of clinicians away from the bedside into more administrative roles. And we also saw, in addition, a spike in workplace violence. Patients were angry. They were aggressive. They became combative. They couldn't have family members present. They didn't like the long wait times. They were angry because they sat day after day in a hospital bed without a determined discharge plan. The emergency departments became a dangerous place to be. The number of patients waiting to be seen was very high, and security had to be stationed in the emergency room just to maintain a peaceful environment. Also, there's things beyond COVID that cause issues in the nursing world. So there are pay inequities between care settings. Acute care seems to be the highest paid for the direct patient care staff, and they certainly deserve what they get. But it's hard to attract clinicians to positions in the community that pay much lower rates, such as skilled nursing facilities and home care nursing. And so if we're going to focus on patient progression across the healthcare continuum, there needs to be a continuum. And we have to focus on the importance and the value of clinical staff in all care settings. And we need to work on closing the gap of pay inequity if we expect a pool of community-based resources for our patients' next level of care beyond acute care. A couple other things, lack of shared decision-making. Nurses certainly understand the need for change. They understand continuous quality improvement. They understand the definition of insanity is to continue to do what we've always done and expect different results, right? And so they want to and they need to be part of the change process.
Yeah.
They certainly don't want somebody far from the bedside to decide what process they should be following. And so they're the experts. They have the best ideas because they live it every day.
Sure.
They know what changes will be sustainable versus the flavor of the month that only lasts a couple of weeks. And then finally, lack of opportunity for advancement. Not every clinician wants to move away from the bedside. Not every clinician wants to pursue formal advanced education or certification. So there needs to be a method where clinicians can grow in place. So, nurses are lifelong learners. Clinical ladder is key to keeping them engaged and motivated. And as they climb the ladder, they have a sense of accomplishment, recognition, and hopefully a bump in compensation. So to sum that all up, nurses, strong, smart people, they're committed to their profession, but they need a safe, collaborative, supportive relationship with their employer. They need to feel valuable and compensated fairly. And those are really the major causes of the shortage of nurses. And if we can fix that, Eddie, we can see more people gravitating towards the nursing profession.
Got it. No, thanks, Patrick. I mean, again, I think you covered quite a bit there. And it's obvious that there are a lot of, challenges driving this problem that we're facing. And, the pandemic seems to definitely have left a mark, a not so good one, obviously.
For sure.
On every part of our society, but obviously particularly when it comes to nursing.
Yeah.
What should we learn from those early days of the pandemic, Patrick, that might be able to help us better be prepared and take better care of our healthcare workforce in the future?
Yeah, so, to understand or at least anticipate what the full impact will be, there were staff that were furloughed, but other staff were working extra shifts, so that was confusing to a lot of people. To invest in staff versus agency and keeping employee morale high, especially during trying times, you want your staff to feel supported and well cared for. Patient isolation led to anger and frustrations and eventually workplace violence. So knowing and advertising visitation policies, making sure it's compliant with updates. We want to ensure and enforce equally across the board to decrease frustration on the patient and caregiver's part. We want to prepare and support all levels of care, including home care and facilities, to be ready to step up on day one. A lot of great protocols were developed during COVID, so be ready to dust those off and implement them early in future pandemics. And then, of course, ensuring clinician safety and provide counseling. Many were devastated as they watched patients die alone.
Yeah.
Many were dealing with angry family members. The ED was a dangerous place to work. So offering the staff emotional support to get them through those tough times to certainly benefit those who struggle.
Thanks, Patrick. Again, a lot of good strategies that we can consider moving forward. If we are faced with a similar type of global challenge as we faced back in 2020. I wanted to touch a little bit on, how our training programs are doing, trying to prepare the next wave of professionals, right, to step into the workplace. And in some cases, it's, a bit of a chicken and the egg problem, right? For example, nursing schools have been reporting that they have a shortage, right, of seasoned faculty, which then leads to them restricting enrollment, which can contribute to further shortages, as you can imagine. Mm-hmm. Have you observed in your experience that training programs are able to continue to keep pace with the need these days, given some of these challenges I've mentioned here?
Yeah, for sure. And, I think things are certainly changing for the better. We're seeing less strict schedules and more alternative options. We're seeing more online, learn at your own pace sort of coursework, more flexible clinical rotations. Before, if you couldn't do a clinical rotation Monday through Friday 8 to 2, you couldn't do a clinical rotation at all. And so now we're seeing evenings and weekend opportunities open up. We're seeing associate programs leading into bachelor's programs that lead into master's and doctorate programs, making it easy for the person who wants to pursue advanced education to get those degrees. And so all those changes are starting to attract the younger generation who looks for more technology and learning. But it's also attracting our second career population that need flexibility in school schedules to accommodate their work schedules.
Well, that's good to hear that those issues are being addressed by schools and others. I wanted to jump back to an issue you brought up a little earlier, and that's around job satisfaction. And it being a key contributing factor to the nursing shortage. What are some of those strategies that facilities you feel can implement to help address that head on, Patrick?
Yeah. So again, there's several components to this answer, but, certainly stay interviews. We're so used to exit interviews, asking people why they're leaving, right?
Yeah.
And the ship has sailed at that point. You lost them. And so stay interviews, ask the employee, why do you stay here? What makes you happy? What brings you joy? And we can use that to inspire others to stay. Nurses want shared governance. They want shared decision making. They don't want to be told what to do. And for buy-in, it's important to involve the staff in that decision making process. Strength assessment. What are you good at? What do you like to do? And then creating opportunities for clinicians in the areas that they can excel in. Certainly working at top of licensure, all clinicians at all different levels want to focus on the clinical aspect of their jobs and less on administrative tasks. Alternative work schedules. Not everybody can work on Monday through Friday, 9 to 5. So offering those off-hour work schedules will bring some satisfaction to staff. Certainly management support of the boots on the ground in all care settings. So, staff who feel supported by management will be your most productive employees.
Sure.
Just a couple other things, pay them what they're worth. Obviously, that goes without saying. Recognition for a job well done. And for those who are constantly going the extra mile, and then encouraging staff to present their own work, share their best practices with peers, and inspire others to grow.
Okay, got it. No, that's a good list. That folks can work off of to try to address this issue of job satisfaction head on. I want to also touch upon another theme you brought up earlier at the top, Patrick, and that's really around workplace violence, which is unfortunately not an uncommon occurrence as you described. Can you talk to our audience members a little bit about the ways that facilities can maybe mitigate that risk these days?
Oh, for sure. There are so many ways. Number one, safe patient ratios is key to being able to provide appropriate care to patients. Proper education and training of all staff. So much of the work that we do is just-in-time training, and we really need to prepare our staff and our nurses to deal with the situations that might come up. So instead of just-in-time training, let's give them the education they need to work through those issues. Creating a safe environment for staff, training on de-escalation techniques. We have a high mental health population, and if we know how to manage them in facilities, there'll be less sending them to the emergency room for psych evaluation. So de-escalation techniques, training staff on trauma-informed care and triggers to avoid a crisis. We'd love to see senior leadership rounding to show support for the staff, security officers for escalation, and then just finally tight communication with the care team, including the patient and the caregiver. That'll decrease a lot of fear and anxiety on the patients and family who wait to hear from the care team on what the plan is going to be. And so all healthcare workers deserve a safe environment, and it's up to leadership to make sure that's a top priority.
Yeah, no, absolutely. Really, has to be a big priority, right? If we're going to be able to tackle this issue successfully. Mm-hmm. I want to shift gears a little bit, Patrick, and really maybe talk a little bit more about the impact staffing shortages are having on health outcomes, right? Because, it would make sense to assume that staffing shortages would be tied to poorer health outcomes. In fact, staffing levels is one of the measures that CMS looks at when evaluating nursing homes for its star ratings. What are some unexpected ways you feel that staffing or lack of staffing can impact quality measures these days, Patrick?
Yes, so we know evidence-based practice, patient-centered care, continuous quality improvement, those are all proven ways to improve quality measures. Certainly good nurse-to-patient ratio is key to good quality outcomes. But some unexpected ways staffing can have a poor impact on quality outcomes is inconsistent caregivers leads to adverse event. If every day you have a different clinician taking care of you, they have to learn your history. They have to learn all the things that they need to do to care for you for that day, and things get missed. So that's an adverse outcome for sure. Decreased morale leads to a toxic environment. Unhappy staff just creates an environment that's just not conducive to healing. And less time with patients leads not only to adverse events, but also decrease in patient and staff satisfaction scores. So I'll stop there, but the list goes on and on.
Got it. Now I'm sure the list can go on and on there. I want to jump back to, another sort of underlying cause behind the shortage here. And that's one really of just the demographics of our nation. Some of the staffing shortage is likely a product of, our population aging, while there are fewer younger people to enter into the caregiving workforce. As someone who has been in the profession for many years, what would you suggest or say to a young person considering a career in healthcare today, Patrick?
So, I would say if you have a passion for working with patients and family members, if you like to teach, if you want to make a difference in people's lives, if you want to be part of a community that promotes health, if you want to be part of the most trusted profession, then a career in healthcare may be just what you're looking for.
Good advice. Well, I want to thank you, Patrick, for the time you spent here with our listeners and for sharing your perspectives on this tough issue around workforce shortages affecting our country today and, potentially even lingering into the future.
Absolutely. Thank you, Eddie. Thanks for having me.
It's time for us to crunch some numbers in our Data Watch portion of the program. Recently, we've been hearing a lot about the declining birth rate in the United States. In 2024, there were just over 3.6 million births in the U.S., according to the Centers for Disease Control and Prevention preliminary data. That's slightly up from 2023's final number. Despite this slight increase, U.S. birth rates have been trending downward for the past several years, with small but steady declines recorded each year from 2019 through 2023. Meanwhile, life expectancy in the United States is increasing, with death rates declining. A baby boy born in 2022 can expect to live to almost 75, while females could expect to reach 80. Even better news, the age-adjusted death rate decreased by 9.2% from 2021 to 2022, according to the CDC. That's it for this episode of Quality Watch. I'm Dr. Edison Machado, and on behalf of IPRO, thank you for listening. To learn more, visit our website at ipro.org. That's IPRO.org. And if you enjoyed this podcast, please leave us a comment and subscribe wherever you listen to podcasts. We'll be back next month with more. And until then, we'll be working on better healthcare realized.